William Courtney. I'm a physician. I work in the area of cannabis, and particularly in the area of raw cannabis, which, because it's not psychoactive, it appeals to everyone. At least half the population really is, a little hesitant to engage in THC products. But if you've got a medical problem, you've got inflammation, pretty much the entire population is looking for relief, and so it opens up the area of cannabinoid treatments to everyone, which is really is another exciting part that I really didn't speak much about in terms of accessibility and the ability to help everyone, rather than just those who are THC tolerant.
For many people across our country, I'm sure, and the people I've talked with, they don't understand the difference between consuming cannabis the way everyone else does and consuming it raw. What is the major difference here?
Major difference, we have a series of strains that are called ACDC. AC stands for alternative cannabinoid, which is the CBD acid molecule, which has kind of come into focus recently as being very important as an anti-inflammatory. And DC stands for dietary cannabis. And then the humorous part, which appears to be an important part of naming cannabis plants, is it kind of goes both ways. If you do heat it, then your dose limit's around 10 milligrams. And if you don't heat it, if it's raw, then your dose limit is 1 to 2,000 milligrams. So the name kind of ties it all together with, includes CBD acid, it's dietary, and if it's unheated, your dose can go up by a factor of 100, where it becomes much more effective as an antioxidant, anti-inflammatory, anti-diabetic, anti-ischemic, a lot of the more unusual properties, but it does lack the psychoactive. And like I said, for many people, the lack of psychoactivity is actually a benefit. And some people don't like it at all. Some people don't mind it a little bit in the evening, but now you've got a way to use the plant when you get up in the morning and while you're driving and around the clock without having any side effects that compromise your safety or well-being.
So essentially you're saying the process of heating, which is what most people think about when they're consuming cannabis, actually changes the cannabis, doesn't it?
Cannabis is the poster child for raw food. Eaten raw, in any way, is salad, blended juice, as long as it's unheated, it has phenomenal properties. And then when you heat it, some of those properties are deteriorated, and some of them are altered. And then the really big one is the creation of THC, which is so potent at a very low dose that it restricts your comfortable use to the 10-15 milligrams, which is really inadequate for many of the other functions of the plant. So there's many things that happen when you heat it. But as you mentioned, we've been doing that for about 10,000 years, and even in California, 99.99% of people equate cannabis with psychoactive use, and so it's a common misnomer, and it's very difficult for me to hear speakers and people say cannabis and THC and use those interchangeably, because there's so little THC in the plant that you cannot get high from eating it. It's there, but it's there in very trace amounts. It requires heating to convert the THC acid, which is non-psychoactive, into the THC, which is very, very psychoactive.
I see. Now, so what you're saying is there's far more medicinal benefit actually to consuming it raw.
Phenomenally more benefit, because it's the dose restriction of the psychoactivity. The psychotoxicity is not pleasant. So we've got euphoria, for some people, runs 5 to 10 milligrams. By 20 milligrams, most people are dysphoric, which means they're slurring, they're staggering, and this is like they ate 2 brownies and they really only wanted a half one. And then psychotoxicity is when you eat 5 or 6 or 7 brownies and all of a sudden they all catch up, and then you're really uncomfortable for several days. But it's that intolerable toxicity that really constrains people's use of cannabis. And most folks have overdosed once. Few folks overdose twice. I mean, the first time was unpleasant enough that they're not going to overindulge in cookies or brownies, and it's the baked goods where you can consume more than you want and you won't know about it for an hour or two. You eat that first brownie, hasn't even had an effect yet, and the young adult, which is often the person that overdoses, they eat a brownie, go, well, there must not have been any pot in that one, so they have another brownie, and they, well, I'm still not feeling anything, so they have a third brownie, and sometimes they have a fourth or fifth before the first one actually begins to have a psychoactive effect. And after the first one comes on, they're going, well, that's cool, I can relate to that now. And then the second one begins to raise their serum level higher, and it's like, whoa, this is not so fun. By the time the third one hits, it's kind of like, oh, I'm getting a little scared here, and it becomes a real negative experience to the point that 30 years later, they will remember, like, wow, I was first year in college, or I was at a high school party, and I had 4 or 5 brownies, and so when I first began to talk to them about eating cannabis, they look at me horrified. It's kind of like, oh, I tried that once, so I'm not going to do that again. And so when you first say, eating, it'll elicit a negative reaction 80-90% of the time with people who say, oh, I stay away from eating cannabis. I can't control that.
I mentioned to you a little earlier that I know someone who has Parkinson's disease, and I mentioned to them about raw cannabis, primarily because when they have consumed cannabis in the past, he's already experienced dizziness already, particularly problems whenever he stands up. He has that drop in blood pressure and all, and he says when he consumes cannabis, it just adds to the dizziness that he experiences already. Have your experience with people with Parkinson's disease?
The raw there's the THC that can make the heart race and produce vascular changes and produces the anxiety that, and in intermediate to advanced Parkinson's, there can be some thought disorder issues that come up. And so the first approval of CBD by the Food and Drug Administration was as an investigative new drug in psychosis related to Parkinson's. That was the first federal kind of, since the 1990s, the first additional use. And so they're not giving those folks THC, but CBD, which is an antipsychotic and an anti-anxiety, and at other levels an antidepressant. So it can help support from that aspect. Also, as we hear today, it's a very potent anti-inflammatory, antioxidant, and a direct stabilizer as a neuroprotectant. There are the white blood cells that surround nerve tissue, the microglia and astrocytes. Those are cells that, if the nerve becomes injured, sometimes they can prematurely destroy and consume and remove the injured nerve. And one of the things that CBD does is it stabilizes so that there can be a better chance of recovery, and 2, it dampens down the microglial reaction, allowing that injured cell the time that it needs to recover. So, as well as being an anti-inflammatory. So there are multiple effects that come into play with the chronic neurodegenerative conditions, and those pretty much include Alzheimer's and Huntington's, as well as Parkinson's, and as well as traumatic events which produce intracranial injuries.
For someone with an illness such as that, how would they consume cannabis raw?
The cannabinoids are fat soluble, so at this point we're trying to encourage people to put the cannabinoids into a drink that has a lot of fat content. Something that has like yogurt or ice cream, or has coconut milk or hemp milk. Anything that, as you increase the fat content, then the cannabinoids can dissolve into that fat, which will elevate the amount that you can have per milliliter of juice. And so that can be helpful. Flavor is just critical. If the flavor is unacceptable, then compliance will never occur. For one reason or another, the whole trial will fail quickly if flavor is not openly discussed, addressed, and remediated. You've got to find a way that they feel that that's an enjoyable part, because you're asking them to do something kind of all day long, and if it's bitter, acrid, or whatever, it's like a hearing aid. If you stick a hearing aid in and it amplifies loud scrambled noises, you're going to lose a lot of hearing aids. You're going to lose them every time you turn your head. If a hearing aid amplifies and has benefit, then the person will keep track of it because it is an assistance.
I'm sure each patient is different, but what are we talking about as far as dosage?
Well, the Food and Drug Administration for the psychosis is about 600 milligrams. The Department of Health and Human Services, in its effective oral human dosage schedule, runs from 1 to 40 with a kind of focus on 5 to 20 milligrams per kilogram body weight. And then they summarize that guideline with, and in particular, 20 milligrams. So they're pretty focused on that. Study, I think it was on CBD as an anti-inflammatory, was talking about 25 milligrams per kilogram. So there's a range between the FDA dose, which is probably in the 6 to 7 to lower milligrams per kilogram, through the Department of Health and Human Services that moves it up to a higher dose level, 1,000 milligrams a day to 1,500 milligrams a day in order to attain that 20 milligram per kilogram schedule that they kind of recommend.
You find that to be pretty effective as far as helping patients to titrate their current pharmaceutical dosage?
You mean other medicines they're taking? I find a phenomenal number of people that are able to slowly wean themselves off of a lot of Western medicine. The one child I was talking about today that had the Dravet had been on very high dose Topamax, and it took them about 4 months because the side effects were pretty serious. But they just kind of kept cutting back, and they now have, after I think it was 4 months, they completely got off a medicine that they'd been on for 4 years. And when they were on that medicine, they were having hundreds of seizures a day. And now that they're off that and using these CBD tinctures, sometimes they're going 2 and 3 and 4 days without a seizure.
You said CBD tinctures?
Yeah, tinctures in this case. I was involved kind of in securing the plant, and a woman was preparing the product, and the tinctures, kids are going to have a harder time with flavor and taste. The one baby girl that had the brain tumor, she was doing juice, and she was doing a lot of juice, and one of my bigger questions was, how did they get that juice into her? I mean, kids sometimes can be pretty finicky, but maybe after spending a year in a pediatric oncology ward, a lot of things change.
Taste and situations like that, I'm sure, seem pretty small, by comparison. I've had children with considerable illness and spending a lot of time in hospitals, and our barrage was so much is in conventional medicine. Yeah, and this girl, one of the brain tumor. For the rest of my life, I remember that any person that came within her line of sight, she would reach out to hug. And if her father was holding her, somebody walks by, she would spin around on her, around her waist, an incredible way to reach out and hug each and every person that she saw. It was mind-bogglingly beautiful. I mean, she was, and so that's a person and she was also the same one that was drinking, 6-8 ounces of raw cannabis juice. That would be a challenge for an adult who was trying to deal with a life-threatening illness. How could someone get more information about consuming raw cannabis?
There's a lot of information at cannabisinternational.org. A lot of interviews, a lot of patents, a lot of articles. We're in the process of trying to put together a 3-hour, a 30-hour, and a 300-hour self-directed internet study course so that you could come there and be a series of links. And so depending on one's background and interest, you could kind of get an overview or some good working knowledge, or you could, if it's really, really important and you had excitement for the process, you could, indulge in, because the more you understand physiology, microbiology, cell biology, chemistry, the more that stuff makes sense to you, then the more excited you get about cannabis because of you understand how it acts. It's no longer kind of a black box thing. You really get a sense that it's augmenting the cells regulating itself more effectively, and just as an adjunct to supporting your own feedback modulation of cell physiology.
I've been concerned for some time about the cumulative effects, or I should say side effects of pharmaceuticals over the course of time. How do you feel about cannabis, or particularly raw cannabis, as over the long haul?
I think it's something you should have before you're conceived, and something that you would want to take until you stop consuming. I think that's, the idea that you could prevent brain tumors in children, is certainly a much better way to go than waiting until they're sent home on hospice to die to start treating them. We care so much about our children, and yet they're the ones that we think should have the least access. They should have the first access.
That's amazing. Yeah, that seems to be a touchy subject when you talk about children and cannabis, doesn't it?
Yeah, very touchy subject. And I got a case of a patient who had a child ripped off of her breast, and there was audio tape. And this police officer is saying, you're being arrested for cultivation and with intent to sell. Oh yeah, and child endangerment. And this woman is just screaming, like, give me my baby back, give me my baby back. And then it turns out that the federal government will pay municipalities for removing children from endangered environments. And so in hard economic times, you can go remove some kids from cannabis families and balance the books for the month or something. I mean, I call it a dietary essential, and these other folks are destroying families and individuals' life. And I can't believe that they know more about it than I do. So my sense is that they have a fear that cannabis is bad, and based on that fear, and the fact that they may need some money, they're out there just destroying people.
The fact is, cannabis is a superfood, isn't it?
I was trying to select a term, and superfood just sounded a little too, not necessarily new age-ish, but just sounded a little far out there. So I went with functional food, which was a Japanese term for something that provides benefits in excess of nutrition. The hemp milk and the hemp seed, we know, is an excellent source of the essential amino acids in a very balanced format, and it's also a source of the essential fatty acids, uniquely balanced of all the grains and all the foods out there. There are other that are higher in omega-3s, but the oil that comes out of hemp is 3 to 5. The ratio of omega-6s to omega-3 are 3 to 5 to 1, which is the ratio that humans need those two essential fatty acids in order to construct and to use them to build other molecules. And if you have more of one or the other, the extra is just consumed as carbohydrate and is burned up and turned into calories. So anything outside of that ratio is really not of benefit as an essential fatty acid, because that doesn't have the matching half of that equation. So it provides us with not only a lot of oil, but a perfectly balanced oil, so that all that oil is effectively converted into fat products that are made from. The definition of an essential fatty acid is an acid that we cannot synthesize, that we have to acquire in our diet. And so it's a very valuable food material that will be used to make other products that we can, that are essential for life. And so, and then on top of the essential amino acids and essential fatty acids, it's the unique source of these essential cannabinoid acids, as well as an incredible array of terpenes and flavonoids that, have just a wide range of, dietary uses.
Would you say that dietary changes would also be essential for someone who's dealing with chronic and terminal illnesses, even apart from cannabis?
Apart from cannabis, I mean, just
in addition.
Oh yeah, I was studied nutrition before I went to medical school, and nearly got kicked out of medical school because I was insisting that they supply doctors with some nutritional background, and I was told by the dean that if you want to study nutrition, go to a nutritional school. So we pretty much came to almost blows. I mean, he was ready to throw me out, and I was ready to bring in investigative reporters, and we were having. This is all over just about whether or not we should learn about nutrition. So, the more you know about that, cannabis is just part of that. I mean, cannabis is really just part of the nutritional area, and other plants, fruits, fresh food. There was a book one time whose bottom line was, if it doesn't look like food, don't eat it. And if you could live by that guideline, you would be you do amazingly well in terms of maintaining health and supporting your body. It's when you eat stuff that's in boxes and cans and plastic bags that we get ourselves into lots of trouble.
Not much for nutrition there, is there?
Well, there's chemicals, and it's processed, and it fills you up, and so you don't really have appetite for other things, and so it's a poor substitute for something that looks like an apple or a carrot, or something that looks like food. You get full on potato chips or Hostess Twinkies or something, and then you don't eat anything else. You get those empty calories.